And good evening, everybody. Let's start talking about a topic that's incredible because most of us on the journey toward healthy nutrition and lifestyle, we've been on this road for a number of years. Some of us possibly learned when we were really young and can say they've been following a healthy lifestyle for decades. But tonight, our special guest, who's a sports and lifestyle physician, is also a fourth generation plant-based eater whose family has been eating this way and helping others in their journey for over a century. Tonight, our topic is cardiovascular health, nutrition, and the intersection with your orthopedic system. And we are thrilled to have as our guest Dr. Stephan Esser, who will be here tonight. And I think he is there right now as we're all coming on stage to be able to talk about this critical topic for everyone. So I'm Jim Spellos from Planned Powered Metro New York, along with my co-hosts Judith Zerden and Ben Mertens. We welcome you to another episode of Heart to Healthy Heart, plant-based conversations that can save your life. As always, please use the chat box, tell us where you're viewing from, and also ask any questions of our special guest. We're going to try to get to as many as we can as our 30-minute time slot can accommodate. And now let's just give me a quick second to get an introduction for Dr. Esser. He's a sports and lifestyle medicine physician, fourth generation, as I mentioned, plant-based eater, and former #1 in the world in the US, I should say, in men's open tennis. I believe that was doubles. He completed his medical school at the University of South Florida, residency at Harvard Medical School, and sports medicine fellowships at Mayo Clinic. He's been a faculty member, author, team physician for professional sporting events, and specializes in the integration of basic lifestyle measures with cutting-edge biologic interventions. Dr. Esser, thanks so much for being here tonight. We really appreciate it.
Well, I'm super excited to get to join you and so excited for all of your audience for the passion that you guys bring to the table with every one of these presentations. So thanks for the invite.
Our pleasure. Why don't we start this way? Our focus, as you know, is the health of the heart and the cardiovascular system. Your focus is as a non-operative sports and spine physician. So share with us the connection between exercise, healthy bones, and cardiovascular health.
You know, what's so exciting is the literature has radically grown in the last 20 years, demonstrating that the food that you and I eat not only radically predicts your risk of the #1 cause of death, which is, of course, heart disease for both men and women, but also the health of your musculoskeletal system. Starting at the very top with generalized blood flow or perfusion, right? As you eat these micronutrient-rich foods, these flavanol-rich foods, these nitrate-rich foods, the deep greens, purples, reds, blues, etc., you dilate your blood vessels everywhere, not just to your heart and your kidneys, not just to your scalp and your skin and your penis and everywhere else, but also, as it turns out, to your muscles, your tendons, your ligaments, and your bones. Good perfusion is the heart of recovery and of growth and nutrition to these tissues to allow you to perform at your best, whether that be climbing a few flights of stairs, playing with the grandkids, or shaving off microseconds, milliseconds from your sprint time. And so it turns out that when you have good perfusion to your heart, to the rest of your body, you also get good perfusion to your bones, to your muscles, and your tendons. And so studies now demonstrate, for example, that if you have elevated cholesterol, you have higher rates of rotator cuff tears and of Achilles tendons tears. And if you have elevated blood pressure, you have higher rates of osteoarthritis of your knees, independent of your weight, age, and everything else. So there are these incredible intersections, it turns out, between what you eat and how you perform and how you age at the musculoskeletal level.
Judy?
Okay, yeah. So that was what I wanted to talk to you about some of the studies that are so interesting about the relationship between musculoskeletal and cardiovascular health. So, and it sounds like perfusion is really at the heart of all of this stuff. So are people who have inflammatory cardiovascular diseases such as atherosclerosis then shown to be more likely to have low bone mineral density and have more bone fractures?
It does turn out to be that case. And so, for example, if you look at the largest blood vessel in the body, which is the aorta, right? So the heart, right, kind of here, and the aorta comes out. The aorta has little feeder vessels on the back side of it that feed the spine, right? So your spine is kind of all through here, bone, disc, all the way down. And it turns out that if you take an x-ray of people's low back and you see that there is atherosclerosis or aortic calcifications, hardening of the artery, they have higher rates of spinal degeneration, right? Of discs drying out, bones becoming weaker. In addition, if you look at long bones of the body, right, like the femur or the tibia or the humerus, the arm bone, these all require really good blood flow. Here, these little capillaries, little arteries feeding them. And studies show us that if in fact you have aortic calcifications, these bones do not get as good of blood flow. And then what happens is you lose the density of the bone earlier and you have higher rates of osteoporosis. So it turns out that blood flow influences the density of our bones. And if you, on an x-ray, see aortic calcifications or on like a calcium CT score, see that you've got significant calcifications, you are predicted to have higher rates of osteoporosis because you're impairing the delivery of nutrients to the inner part, right? The bone marrow of the bones and the cortex as well. So we want to improve that blood flow, thereby bringing the nutrients to the tissues that most require them. And thus they can age more slowly and be healthier longer.
Wow, that's fascinating. Ben, do you want to talk about the changes to bone mass?
Yes, Dr. Esser, good evening. How does our bone mass change as we age?
Well, unfortunately, our bone mass declines over time. In particular, this occurs more commonly with women than with men, and we believe this is associated with a number of issues. Number one is going to be the hormonal relationships. We know, for example, as a woman reaches menopause, that she has a very steep decline in bone density related to the decrease in estrogen production, because remember, estrogen is a growth hormone that keeps the bones solid and stable. Number next is, on average, women do not peak at the same level or percentage of lean body mass as males. And it is the demand of lifting heavy objects, pulling on heavy things, that puts pressure across the bones and causes what are called osteoblasts, which are bone building molecules, to increase the density of the bone. So we want more people at a younger age to be pushing their muscles and their bones and their tendons, their ligaments a little harder so that they can build thicker, heavier, more dense bones and more lean muscle mass. A woman on average loses about 1% of her bone mineral density per year after the age of about 35. Wow. Now, interestingly enough, the appropriate exercise can prevent bone density loss by 1% per year. So you can kind of get to a good equal place there in maintaining the bone density of a woman if the exercise program is appropriately done and done regularly. Now, don't forget too, resistance training, according to the American Heart Association, has very powerful effects with regards to perfusion throughout the body, reducing blood pressure, decreasing resting pulses, and having powerful effects on all of the cardiovascular risks that are out there. It's not just running and biking and all the cardiovascular exercise that helps the heart. Resistance training has powerful effects as well.
Thank you.
Wow, that's fascinating. I wish I had known this years ago.
That's right. You still got a breath. You've still got a breath. You still got a heartbeat. There's time.
Okay.
That's right.
All right. So let's dig into some of the risk factors for osteoporosis and fractures, both those that are modifiable and out of our control.
Yeah, so certainly if you're a Caucasian, if you're a female, and if you're over the age of, let's say 50, you're going to have a higher risk of osteoporosis. In addition, if you've been on various medications, everything from proton pump inhibitors that are used for GERD or reflux to things like chronic steroid use, these are going to limit or weaken the bones over time. Now, the risk factors that are in our control, very much so, include what I mentioned, exercise, as well as the diet, the nutrition that we eat. When it comes to the nutrition, there are a couple areas we don't talk enough about. Yes, we talk about calcium consumption in those deep green vegetables and our figs that are loaded with calcium, et cetera. But also, and then our vitamin D exposure, right, with the 15 to 30 minutes of sun exposure, or possible supplementation if needed. Deep green vegetables for our vitamin K2. But then we also need to remember that the consumption of large quantities of caffeine, so even if you're having more than 2 cups a day of a caffeinated beverage, even if it's green tea or black coffee, these are diuretics. Caffeine is a diuretic, and it makes you increase your urination, and you're more likely to pee out your calcium. And so you can go into a calcium deficiency just from exceeding the amount of caffeine that is ideal. Number 2 is going to be sodium. So remember, calcium, Ca, calcium, is a plus molecule. It is a cation. And in addition, sodium, Na plus, is a cation. The body is trying to constantly find an equilibrium in cations, positive charges, and anions, or negative charges. So if you consume a whole lot of salt, right, which in America, unfortunately, 90% of individuals consume above the upper tolerable limit of salt. You and I should all be getting around 1,500 to 1,800, if not less, milligrams of salt per day. If you eat a pure salt, oil, and sugar-free program of whole minimally processed plant foods, you probably will get about 600 to 800 milligrams of salt per day. But if most people in America are consuming more than 4,000 to 6,000 milligrams of salt per day, and when they do that, the body says, whoa, too many cations. And what's it going to do? It's going to make you pee out your calcium to compensate. So you're going to consume the salt, which is going to make you retain fluid, increase inflammation at the joint level. It's also going to, of course, damage the endothelial lining of your blood vessels, increasing the risk of atherosclerosis. It's also going to prompt you to eat more than you really need because it's an appetite stimulant. And it's going to prompt your kidneys to make you pee out more calcium, thereby weakening your bones over time. So where's the win-win? Reduce the sodium consumption by eating more minimally processed whole foods, and thereby you hold on to more of your baseline calcium.
Dr. Esser, apart from reducing the salt, what else can we do to reduce the modifiable risk factors for cardiovascular disease and bone loss?
Yes. So, I mean, I think that some of the other things that I mentioned there, every single one of us should have a daily routine of exercise. It is no longer acceptable to pretend that you're just doing it through nutrition alone. That's not how it works. Yes, the nutrition is the heart of success for reducing your risk of cardiovascular disease and reducing recurrence of events. However, exercise is what is going to allow you to live a functional and high performance life. And in addition, when it comes to your bones, it is the exercise that is going to help keep those bones healthy, right? Having been now, as you mentioned, in this field for 4 generations in my family, and growing up at my grandfather's ranch, right? 65 years he ran the ranch. I grew up 24 years of my life at that ranch. I saw many people, right, when I first saw them, they were in their 60s. By the time, I was, growing up, et cetera, they're now in their 80s. And I saw so many people who never died of heart disease, but they got incredibly frail because they were not doing the exercise they needed to do. And the exception were the people who had a daily routine. My grandfather had by his bedside one of those old time, decline, sit-up boards. He had his 25-pound stainless steel weights right there. And he had a big medicine ball, 1 or 2 things. He'd wake up every morning, he'd say his prayers, and he'd do his exercise routine. And that's what he did. And that's why, as he was in his 80s, et cetera, he could still lift heavy tables with me and move items. And he could play tennis for long periods of time. And he could hike the mountains and do all these things. Because let's not forget, the goal of living a healthy life is not to check the box and say, look, I don't have any disease. No, the goal of living a healthy life is that you can have the most vital, energetic, health span, right, of anybody. And that you can thrive into your 80s and 90s and continue to have adventures and be the best version of you as a parent, a grandparent, a godparent, a friend, an uncle, a brother, a sister, a creative artist, right? An attorney, whatever your field or career or passion is. Not that you are whittled away, right? Starting in your 40s and 50s, losing your ability and your function and your performance. And exercise is absolutely crucial to help you to achieve that goal long term.
Regarding lifestyle foundations, I heard you a couple of talks, and what do you mean by living in profound simplicity?
Yes, so many people are looking for these magical fixes. Oh, maybe I just need this nutrient in this pill. Maybe I just need this standardized extract. Maybe I need this special sauna, and I need this special heat lamp, and I need this. And it's like all along the way, they're still eating McDonald's. or they're still having their Haagen-Dazs ice cream, or they're still having their steak or their fries and their beer and their wine and these coolers and whatever. And it's like, what are you doing? You're acting as though these very basic, simple premises of health don't matter, and that the real fix is something magical. And I call this the shamanism that has infected our society, right? And that is that we believe that if it comes from a special little canister, if it comes from a special place somewhere where PhDs made it, that somehow it's more magical, right? So even in our language where we talk about superfoods, right? The superfood of broccoli, the superfood of blueberries, the superfood of turmeric. And it's like, well, how about just starting with some rice and some potatoes and some vegetables and a little walk? Let's start there, right? And so many people jump past it. As my grandfather said so well, he said, so many people are unimpressed, right, by the simplicity of the truth, of the pure truth of this message. And so many of us are addicted. We're stuck in our own addictions. And we think we're going to compensate for those addictions with these shamanistic behaviors. The reality is, my friends, as I look at you tonight, it is the reproducible, consistent decisions and behaviors that you make. As I say in my Instagram posts, if you ever want to join me at Esser Health on Instagram and Facebook, is I say, one bite, one step, one thought at a time. That's the heart of your success. Don't try to overcomplicate it beyond that. Start simple, build the foundation, and then if you need some specific little pixie dust on top at some point, so be it. But that is not where you start.
Any specific dietary recommendations you have for musculoskeletal and cardiovascular health?
Oh, absolutely. Right. So the beauty here is that so many people think, oh, well, what's the right diet for my kidneys? And what's the right diet for my heart? And what's the right diet for my joints? And what's the right diet for my bone? It appears that we have, based upon the literature that exists, which is now profound and almost unarguable, unless you're just insane, that the data and the evidence is so robust as to say that the most ideal diet across the board for the universal human being is one that is micronutrient dense, plant-based, with minimal processed foods added in. That should be your goal on a daily basis. And as it turns out, that sort of a micronutrient dense approach to your diet not only radically reduces your risk of heart disease, as we've seen, the only studies on earth to ever show the reversal of heart disease are Dean Ornish and Caldwell Esselstyn, which are less than 10% of total calories from fat and are pure micronutrient dense plant-based diets. That's what's happening there. And those are the diets we should be consuming for our heart health. As it turns out, those same diets enhance perfusion and blood flow, reduce inflammation, and promote a vitality on the tennis court, on the basketball court, on the golf course, on the jog, in the Pilates studio, etc., and in the daily exercise of day-to-day life. Now, if you want to get into some of the little micronucleus where I'd recommend to people to maximize, like for example, I might spend sometimes 4 or 5 hours working out a day. Because I have fun. I run some junior tennis academies for my children and other kids. I'm in the gym working out when I can, etc. And so what I noticed as I've aged now, almost into my 50s now, is that as I work out hard, the first thing I need to do is reduce inflammation. Don't think about getting my calories back. First, reduce inflammation. And to do so, the more micronutrient dense, flavanol rich foods, the better. These are going to be our reds, our purples, our greens, and our blues, right? So that could be that smoothie made of blueberries, spinach, right? A little turmeric root, etc. That could be this fresh squeezed, green juice or carrot juice with apples, turmeric, and lemon that you're drinking. That could be the big watermelon that you eat a couple quick slices of with all of the anti-inflammatory effects there. But we need to make sure that if you're going to create a lot of myokines, which are muscular inflammatory molecules, you need to absorb them right away as well. And not just go right to the brown rice and the sweet potato. Those are good. Those are good calorie-dense foods that will give you back the calories you need, but they're not going to absorb as much inflammation.
Thank you so much. Judy, Jen?
So we have a question from the audience, sort of a two-parter, and I'm going to put it on the screen now. Annette said that she was diagnosed with a vascular necrosis a few years ago, was on pain medication, headed for a hip replacement. However, then she changed to a whole food plant-based diet and the pain went away. And is it possible that she was wrongly diagnosed and the pain went away because of better blood flow to the hip?
Well, she may have had the accurate diagnosis, and if it was early AVN, by getting increased blood flow to the tissues, the AVN may not have progressed. So avascular necrosis is a dying off of the cartilage layer at the end of the bone, secondary to decreased blood flow. So yes, theoretically, if you increase blood flow to that area, you may not have persistent or progressive die-off. And as a result, the pain stabilizes and the joint stabilizes. If the joint stabilizes, then it doesn't get worse. You don't have progressive pain. So if your pain is resolved, congratulations, that's exciting. And likely, again, don't forget the majority of people who do a whole food plant-based diet, number one, they lose weight. Number two, they improve blood flow to the tissues. And number three, they reduce inflammation at the cellular level and they normalize cartilage function. So it's a win-win-win across the board. So that's awesome.
Judy?
Okay, thanks, Jim. So, yeah, so I have just one super quick follow-up to what you said before about caffeine before I ask my questions. Does that hold true for decaf coffees and teas? If you use them, does that also diurese you? And
it shouldn't, because it's the caffeine that is the diuretic.
okay, all right, thanks. So now, okay, so there's been a lot of research about calcium supplementation, and it used to be routinely recommended by endocrinologists and cardiologists and everybody. So, and I think that it still is being, from what I hear, but I think that the wiser course now is to not supplement. Can you tell us about the recent research on that?
The majority of people in America are not deficient in calcium. And so it is more about the hormonal balance. And so remember, you can bring all the calcium you want to the building site, but if the cells that are there don't incorporate the calcium into the bone, they're not going to build healthy bone. And the cells that are at the bone have no impetus. They have no inspiration to build bone. They won't do so. Their inspiration will be appropriate hormones, your thyroid hormone, your estrogen, your progesterone, your testosterone levels, et cetera. And then it will be the demands you put on your body. So there's this beautiful response, right? You put a load onto the bones recognize, oh, we need to be stronger to tolerate this demand. So let's get stronger, right? And so little by little, you can progressively increase the thickness and the density of the bone. And when there's a demand on the bone goes, all right, I'm going to grab some of this calcium. I'm going to use this. I'm going to put it together with a boron, and we're going to make this healthier bone structure. But again, if there is not that demand, right, we're not doing the exercise, et cetera, we're not going to get the bone building effect. It turns out that women who supplement, for example, with calcium have about a 15% higher risk of cardiovascular disease and events. That's a problem, seeing as how the number one cause of death in women is a heart attack. And so, yes, there is almost across the board, unless you have a parathyroid hormone deficiency or some other weird abnormality, you should not be taking calcium, and you should not be ideally drinking plant-based milks that have a lot of free calcium carbonate in them, because that's pretty much the same thing. Remember, the body takes that calcium, takes it with cholesterol. If there's inflammation in your body, boom, there's your atherosclerosis. So you want your calcium bound up in your vegetables, in your fruits, and it's slowly absorbed in that form and broken down and used. So if you get your calcium checked on a basic complete metabolic panel or a CMP, a basic lab value, and your calcium is normal, your free calcium, your ionized calcium, you don't have to be worried about calcium consumption. You've got plenty. Now, you should look at your vitamin D, you should look at your thyroid levels, but you should not be supplementing, with just straight up calcium because of the cardiovascular disease increased risk.
Right. So as far as supplementation goes, do you recommend other supplements like D3 if you don't get enough sunshine, don't live in Florida?
Yeah, so my answer always when it comes to supplements is test, don't guess. So the first thing we should all do is test. You should test your vitamin B12. You should know your vitamin D levels. You should know all of these things, right? Because you are all health CEOs, right? You're all the CEOs of your own health company is the phrase I like to use. So you should know the ins and outs, the reds and the blacks, and the who's hired here and working here. So you should know your values. You should know your blood pressure, your pulse rate, all these things. You should also know those levels. If your vitamin D level is low, you need to get it up. You could try it naturally with 15 to 30 minutes of sun exposure on your face, arms, legs, and back. And give yourself 6 weeks to 12 weeks. But if it doesn't climb at all despite that, then you may want to supplement to get it into a healthier range. But otherwise, no, I don't necessarily advocate the use of supplements like vitamin D, vitamin K2, et cetera, unless you are osteopenic/osteoporotic, or if you have a history of recurrent fractures, or if you have a history of an acute fracture. If you have an acute fracture, meaning it just happened, then I often tell people, vitamin C, vitamin D, vitamin K2, so on and so forth, to try to help in that period of time with maximizing healing.
Thank
We
you.
only have a few more minutes to go. We do have another question from our viewers, and that's a little bit different than what we're talking about. But how do you feel about hormone replacement for women?
I think it's a challenging topic and one that each individual should make in the setting of kind of their known risk factors. So, for example, do they have a family history or personal history of hormonal cancers like breast, uterine, and cervical? If they do, that's very concerning, and you want to be very, very careful with those hormones. Obviously, for women who have just severe sort of menopausal symptomatology or vaginal dryness that drives them crazy or the like, they may need to use a little bit bioidentical hormones or a very small amount, whether it be suppository or topical on the skin. But again, you just need to recognize that the use of these hormones potentially increases the risk of common cancers. And if you have a family or personal history of those cancers, you need to really pray about it and consider, are your symptoms, are your problems you're having worth that potential risk, or are there other alternatives?
Makes sense. We have a few more minutes. Judy, I know you have one more question. Ben, you have one more, so let's get through them.
Okay. All right. So I just wanted to ask you a little bit about these controversial in the, UK studies that found that vegetarians and vegans have lower bone mineral density and greater risk of hip fractures. And there are some people that use that as basis for saying that whole food plant-based diets are not that great. So
Yeah, I mean, the first thing I would just say is the only diets ever shown to decrease to reverse heart disease, right, are strict, plant-based diets. That's number one. So the number one thing most likely to kill you is, of course, a heart attack, right? And it's also number one thing most likely to put you in a nursing home as well. So that's the number one thing, right? So people like to hear good things about their bad habits. So the people who like to eat a bunch of dead animals and refined foods immediately like to take a study like that and say, see, it's not safe, it's dangerous. The reality is that women who are more slender are going to be having higher rates of osteopenia and osteoporosis. That's just how it is, because they're not carrying around an extra suitcase full of weight on their body all the time. And as a result, the body doesn't have the demand. So this gets back to the answer that what I was saying earlier, is that women who are eating a plant-based diet should not stop there. They care about their health and vitality, so they're doing the nutrition, but now they also need to do all the strength training, the resistance training. It makes total sense that if you're more slender, you're going to have a higher risk of osteopenia, osteoporosis. That also goes across the board, even for meat eater women, right? If they're a slender little woman, they're going to have a higher risk of osteopenia, osteoporosis. So the answer is not throw out the plants and pick up the beef. The answer is pick up the weights and start weight training, right, earlier in life, so you can maintain that excellent health and move forward from there. That's at the heart of the message here. I think it's also challenging. Not all plant-based programs are created equal. Right? So eating, kind of a bunch of, iceberg lettuce and a little guacamole is not a healthy diet by any stretch of the imagination. So if you just go out and ask women, what do they eat and what's their average nutrition? And are you a vegan or are you a vegetarian? Well, that's not very sort of kind of accurate to look at how's their overall nutrition. But again, if a woman is more slender, she'll have higher rates of osteopenia, osteoporosis. On average, if you consume a plant-based diet, you'll have a 5 BMI lower than the average standard diet, right? So your BMI is going to be lower. You're going to be more likely to be slender. Thus, you're going to have less weight on your joints. You're going to have higher risk of osteopenia. The answer is strength training, not beef.
Makes perfect
sense. It's my
Actually,
last question. What are your recommendations for strength training?
I think people should be doing strength training at least 3 to 4 days per week. And they should start low, go slow, and keep on going, never stopping. The goal should be that they progressively increase the demand. You don't want to violate the twos. Don't go too far, too fast, too soon. And a great place to start is with either a physical therapist or a well-trained personal trainer. And a safe place to start is always with body weight exercises and bands, and or possibly on seated machinery, starting with 5 upper body, 5 lower body, 15, 20 repetitions, 2 sets, call it a day. And you start very light, so you have full motion, everything feels good, nice and clean, no crazy movements. And you slowly add on every third time or so, add 10% more weight, slowly building up. 2 pounds, 5 pounds, add a little bit more on. Here we go. Yeah.
Great. I'm going to start. Thank you.
Yeah. As we close up, I understand your grandfather, Dr. William Esser, was a visionary when it comes to restoring people's health through whole food, plant-based eating. In fact, I think we found something from your website. So is it still in existence? Are you still doing stuff down there? Tell us about that.
Yeah, so we're not down in South Florida anymore, where he ended up for 65 years with his health ranch that I grew up on. But we are doing and hosting people for juice stays at a little nice 3-tube house right next to my own. And then we also host throughout the year some occasional retreats on the beach, which are really nice, kind of near St. Augustine, in some big houses with, it's great, education, working out, exercise, camaraderie. It's a great stay and people have a lot of fun on the beach.
Amazing. I think that's all the time we have. We actually even went a little bit over, but Dr. Esser, we are all so thankful that you came here tonight for this community and for all you do to help people live optimal lives. So please, if you want to learn more about Dr. Esser, esserhealth.com would be the place to reach you, I would presume.
Yep, we're on the social media at Esser Health. Would love to share the message there too.
Fantastic. As we close out tonight, we're back next month with our next live stream on Tuesday, the 17th of October, when we welcome intervention and preventive cardiologist, Dr. Heather Schenkman, to our show. As always, if you want to watch any of our episodes again, they are all on the Plant-Powered Metro New York YouTube channel. And on behalf of Judy and Ben, I'm Jim, wishing you optimal health, and see you next time right here on Heart to Healthy Heart.